Let's get right into it. Today, we're exploring a seriously fascinating question. Can a simple piece of flute music physically change your eye? We're bridging the gap between an artistic auditory stimulus and strict ocular biology. Now, I know it sounds like a completely unlikely pairing, but as we're about to see in this explainer, the connection between our ears and our eyes might actually be far deeper than we ever realized. This brilliant, kind of bizarre question is the hook of our scientific detective story today. Does a 7-minute session of flute music change the pressure in a healthy eye? We're essentially exploring if something as simple and relaxing as a short instrumental solo can physically alter the state of your eyeball. It's an incredibly intriguing premise, really, because it forces us to ask how our outside environment actively shapes our internal biology. Here's how we're breaking things down today. 1. Flutes and eye pressure. 2. Following the clinical clues. 3. The missing puzzle piece. 4. Testing the hypothesis. And 5. Navigating the unknown. Section 1. Flutes and eye pressure, where the artistic intervention meets ocular physiology. Okay, so the crucial concept to grasp right off the bat is intraocular pressure, or IOP. That's simply the fluid pressure inside your eye. Just think of it as fluid pressure within a totally closed system. And because it's a closed system, it's highly sensitive to physiological changes. So if your heart rate spikes or, your stress levels rise, the dynamics of that fluid production and outflow can shift pretty dramatically. So where exactly does a flute enter the chat? Well, it all comes down to psychophysiological relaxation theory. This suggests that calming music, like the gentle acoustic frequencies of a flute, actually lowers your sympathetic nervous system activity. By bringing down that systemic stress, we might literally reduce the production or increase the outflow of that aqueous humor in the eye, which leads to lower IOP. It's a really profound connection between mind and eye, suggesting that a totally non-pharmacological intervention could modulate your internal fluid pressure. Moving right along to Section 2, following the clinical clues. Let's look at what we already know. Look, science doesn't happen in a vacuum, right? If we check out prior studies, Zhou in 2018 studied music's influence on IOP, which is great, but it wasn't flute-specific. Then we've got Dada in 2018 and Zaher in 2024, both looking at relaxation and mindfulness. They definitely show a recurring theme. Relaxation does modulate IOP. But here's the catch. Look at the population. Dada and Zaher focused entirely on glaucoma patients, meaning a diseased population. So we've got some great clinical clues, sure, but no exact match for our specific question. Which brings us to Section 3, the missing puzzle piece, identifying the research gap. Right now, we're facing 3 massive gaps in the scientific literature. First up, the specificity gap. Previous studies look at music broadly, but we just don't have data on the specific acoustic properties and timbre of a flute. Second is the duration gap. Most studies out there use 15 minutes or more, which means short 7-minute sessions are heavily under-researched. And third, the population gap. We know relaxation helps diseased eyes, absolutely. But what is the baseline physiological response in healthy eyes? These 3 gaps are exactly what justify conducting an exploratory pilot study. And that leads us to the ultimate question driving this whole investigation. Can a short 7-minute flute session induce a statistically significant IOP change in healthy individuals? We're shifting our focus directly from what we don't know to exactly how we plan to find out. Section 4, testing the hypothesis. Let's look at the methodology blueprint. To actually test this in a clinical setting, we've got to set up a direct comparison. It's pretty straightforward. Our independent variable, the intervention we're introducing, is the 7-minute flute music. Our dependent variable, the physiological response we're actually measuring, is the intraocular pressure, or IOP. The execution itself is simple, but it demands absolute precision. Step 1, pre-intervention clinical tonometry. We get the baseline eye pressure. Step 2, the participant listens to the 7-minute flute instrumental session. Step 3, immediate post-intervention clinical tonometry. By taking objective numerical measurements in millimeters of mercury right before and right after the intervention, researchers can use paired t-tests to statistically compare that data. But we have to be meticulously careful of the absolute worst enemy of any clinical trial, the confounders. IOP is incredibly finicky. If a participant chugs a morning coffee or stares at their phone in the waiting room, or even if we just ignore the time of day, which is known as diurnal variation, we can entirely skew those tonometry readings. Honestly, if you don't control for posture and caffeine, you aren't measuring the music's effect at all. You're just measuring the coffee's effect. Alongside that primary goal, we have two secondary objectives: comparing changes between male and female participants and analyzing the response symmetry between the right eye, known clinically as OD, and the left eye, OS. Now, here's why this is so crucial biologically. OD and OS data cannot be treated as totally independent observations. I mean, they're two eyes in the exact same human head, subject to the exact same systemic blood flow and nervous system. So statistical analysis requires a ton of caution here to ensure our findings are actually valid. Finally, Section 5, Navigating the Unknown. The reality of exploratory pilot studies. You know, when you're conducting a pilot study like this, the words you use matter immensely. It's a really fascinating peek behind the curtain of academic rigor. Researchers absolutely must use neutral wording like assessment or exploratory evaluation. We aren't out here claiming miraculous guaranteed cures. We are meticulously hunting for preliminary data. An exploratory pilot study tests a hypothesis where direct evidence is lacking, so maintaining a completely neutral, objective tone throughout the research is just paramount. A genuinely good researcher always challenges their own assumptions, right? So we have to ask, is it actually the acoustic properties of the flute or just the resting effect of sitting quietly for 7 minutes? If eye pressure drops, we have to recognize that simply resting with closed eyes in a quiet clinic might be what's responsible for the physiological changes, rather than the timbre and frequency of the flute itself. To make absolutely sure the research defense is bulletproof, there's a strict 4-step action plan. 1. Share the anonymized data. 2. Secure ethics approvals to protect participants. 3. Conduct the paired statistical analysis. And 4. Submit everything for final faculty review by the strict deadline of July 10, 2026. This pilot study is really just the starting line. Consider this. What would a larger sample size, or comparing flute music to a silent control group, reveal next? That silent control group would finally answer our question about the resting effect, for sure. As this preliminary data paves the way for future discoveries, it leaves us wondering just how deeply our auditory environment shapes our internal biology, right down to the literal pressure inside our eyes. Keep questioning, keep learning, and I'll catch you in the next explainer.